Have you or someone you love over the age of 50 ever experienced sudden dizziness, a brief confusion, or even a strange numbness in the arm that just passed after a while? What if I told you that one of these everyday symptoms, often brushed off or misdiagnosed, could be the body's warning sign of an upcoming stroke? In this video, we're diving into the surprising early warning symptom of stroke that's often missed, and how recognizing it in time could save your life or someone you care about. Every 40 seconds, someone in the United States has a stroke. And every 3.5 minutes, someone dies from one. Yet despite these alarming numbers, many early warning signs of stroke are dismissed even by trained medical professionals. Why? Because stroke doesn't always come with dramatic symptoms, like collapsed speech or facial drooping. Sometimes, it starts quietly, almost like a whisper. One of the most commonly misdiagnosed symptoms, especially in people over 50, is dizziness. Yes, simple dizziness. And that's where the danger lies. Many doctors and patients attribute dizziness to aging, vertigo, dehydration, or inner ear problems. But in some cases, it's a transient ischemic attack, or TIA, often called a mini-stroke. And that mini-stroke? It's not harmless. It's a red flag, a rehearsal for the real thing. Let's break it down. A transient ischemic attack, TIA, happens when blood flow to part of the brain is temporarily blocked. Unlike a full-blown stroke, the blockage resolves itself quickly, often in less than 15 minutes. That's why the symptoms can seem minor, and why people often don't seek help. But here's the terrifying truth. 1 in 3 people who experience a TIA will eventually have a full stroke. And nearly half of those strokes happen within the first 48 hours. That gives us a very small window to act and possibly prevent a life-altering event. The most frustrating part? Many people over 50 are experiencing TIAs but being misdiagnosed. In fact, studies show that up to 60% of TIAs are not recognized as strokes in emergency rooms. That means people are being sent home told it's nothing when their brain was literally crying out for help. Now let's talk about dizziness. Dizziness is one of the most commonly reported symptoms in ERs across the country, and it's often blamed on benign conditions. But here's the key. Dizziness from a stroke usually feels different. Instead of a lightheaded, I might faint kind of feeling, stroke-related dizziness is more often described as sudden and severe vertigo, like the room is spinning, combined with trouble walking, nausea, or blurred vision. Doctors call this central vertigo, and it usually involves the cerebellum or brainstem parts of the brain that control balance and coordination. These strokes are harder to detect with standard imaging, and they're the ones most likely to be misdiagnosed, especially in women over 50. Why women? Because their symptoms often present differently, less dramatic, more subtle, and because of long-standing medical biases, their complaints are more likely to be brushed aside. Let me tell you about Karen. She was 58, healthy and active. One morning, she felt a strange spinning sensation and nausea. She brushed it off, thinking she was dehydrated. When it didn't go away, she went to the ER. The doctor did a quick physical exam, said it was likely inner ear related, and sent her home with anti-nausea meds. 2 days later, Karen had a stroke in her cerebellum. She lost her ability to walk unassisted for months and still struggles with balance and memory. Later, an MRI showed that the first episode was a TIA. Her brain had given her a warning and no one listened. Karen's story is not rare. It's estimated that more than 10,000 strokes a year in the U.S. are misdiagnosed as dizziness or another non-stroke condition. The consequences? Delayed treatment, permanent disability, or death. But it doesn't have to be this way. So what can you do? The first step is to know the difference between benign dizziness and stroke-related dizziness. Here are some red flags. Sudden onset of spinning or imbalance, inability to walk straight or stand, double vision or trouble focusing, slurred speech or facial weakness, loss of coordination or one-sided weakness. The symptoms improve quickly, which often fools people into thinking it was nothing. Doctors use a tool called the HINTS exam to distinguish between inner ear vertigo and a stroke. It looks at head movement, eye movements, and nystagmus, rapid eye flickering. When done correctly, this test is more accurate than an early MRI. But the reality is, most ERs don't perform this test routinely. That's why you must be your own advocate. If you're over 50 and you or a loved one suddenly experience these symptoms, don't downplay them. Ask the doctor, could this be a stroke? Have you ruled out a TIA? Demand proper neurological evaluation. Ask for an MRI if necessary, and never leave until you feel confident that stroke has been ruled out. There's something called the golden window when it comes to stroke treatment, that critical 3 to 4.5 hour period after symptoms begin, during which certain clot-busting medications like TPA can be administered. These drugs can drastically reduce the damage caused by an ischemic stroke, but only if given early enough. The problem is, when symptoms like dizziness or disorientation are misread, people often miss that golden window entirely. By the time they return to the ER, it's too late. The opportunity for life-saving treatment has passed. And that's the danger of misdiagnosis. It doesn't just delay care. It changes outcomes. It turns reversible symptoms into permanent disability or worse. But here's the hopeful part. If we begin recognizing the signs, especially those that don't look like the classic stroke symptoms, we can change the story for ourselves and for the millions over 50 at risk. Did you know that stroke is the third leading cause of death in women? And yet, stroke symptoms in women are less likely to be recognized or acted upon quickly. Why? Because they're often non-traditional. Alongside dizziness, women may experience sudden fatigue, general weakness, shortness of breath, fainting, confusion, hiccups, nausea or vomiting, sudden behavioral changes. Now imagine walking into an ER with those symptoms. What do you think happens? In many cases, they're dismissed as anxiety, menopause, or just stress. One 2014 study found that young women under 55 were 33% more likely to be misdiagnosed in the ER when having a stroke, compared to men of the same age. That means we need to rewrite the mental script of what a stroke looks like. Because it's not always someone clutching their chest or slurring their speech. Sometimes, it's a woman sitting quietly, confused, and nauseated, being told it's all in her head. So, what can you do today to protect yourself or someone you love? Let's break it down into 5 simple but powerful steps. 1. Know your risk factors. After age 50, stroke risk increases dramatically, especially if you have high blood pressure, diabetes, atrial fibrillation, high cholesterol, a history of smoking, obesity, poor sleep, or untreated sleep apnea. Managing these conditions can cut your stroke risk by more than half. 2. Take symptoms seriously. Even if they're minor, even if they disappear. Don't brush off sudden dizziness, weakness, or confusion. Time is brain. 3. Push for the right tests. If you go to the ER, ask specifically for an MRI, not just a CT scan, a neurology consult, a HINTS exam for dizziness. Be polite, but persistent. You have every right to advocate for yourself. 4. Educate your family. Make sure your loved ones know the signs, especially if they're over 50. Print out a stroke checklist. Keep it on the fridge. 5. Practice the FAST method and more. You may have heard of FAST: face drooping, arm weakness, speech slurred, time to call 911. But consider adding BE FAST for better coverage. Balance issues, eyes, sudden vision loss or blurriness. Because balance and eye symptoms like dizziness and double vision often show up first in brainstem strokes. We get it, no one wants to rush to the ER for every dizzy spell. But here's a practical guide. If any of the following apply, go to the ER immediately. The dizziness was sudden and severe. You have trouble walking, talking, or seeing. You feel numbness or tingling on one side. You feel off in a way you can't explain. You have a history of stroke, TIA, or heart disease. Even if the symptoms go away, they may still indicate a TIA, and that means you're at high risk for a full stroke in the next 48 hours. Think of it this way. Would you rather feel embarrassed for overreacting or lose your chance to walk, talk, or live independently? Stroke doesn't care if you're busy. It doesn't care if it's the weekend. It doesn't wait until it's convenient. So we have to be ready. And the first step is awareness. The more we talk about stroke, the more we understand its hidden signs, especially the ones that get ignored, the more lives we can save. If you're over 50, talk to your doctor about your risk factors. If you've had unexplained dizziness, press for answers. And if a loved one experiences strange or sudden symptoms, don't wait. Act fast. Or better, be fast. Know the signs. Trust your instincts. Speak up for yourself. Educate someone today. Because your life, your voice, and your story are worth protecting.